At the most recent West Bloomfield Township Board meeting, officials voted to approve joining an Oakland County-wide mental health program, uniting local police with mental health practitioners. Here's more on the goal of that program.
The goal is to really get a person connected to services immediately and make sure that they get connected. So that person is not just taken to a hospital and dropped off and then released 30 minutes later. They've had a point of connection with us, and we can make sure that that person gets connected long term, which we've had a lot of success with. And then ultimately, OCHN has liaisons throughout the justice system, in the jails, in probation offices, with the prosecutor's office, at the hospitals, and we really try to get that person connected along the way. The biggest thing is trying to help de-escalate and problem solve with our police partners when we're there on scene, and come up with maybe some different solutions than what we have done in the past.
And who you just heard there was Hillary Nussbaum with the Oakland County Health Network, Oakland County Community Health Network, just explaining the goal of that program. And the program has expanded over various communities within Oakland County as well to help fight the stigma of mental health. And here's more on that.
We started this program back in August of 2021. We originally began with 3 police departments, Auburn Hills, Birmingham, and Bloomfield Township Police Department, and 1 co-responder. And we've been fortunate enough to move to 16 agencies across Oakland County, and we have 9 co-responders currently. So what that means is a co-responder carries a police radio, and we listen for calls that are related to mental health or substance use related calls. When those calls come out, we can either self-dispatch ourselves to those calls, dispatchers can dispatch us, or officers can call us to that scene.
And once again, from the Oakland Community Health Network co-response team, that was clinician Hillary Nussbaum giving us more information. And joining me right here live on The Splash from West Bloomfield Police Department, we have Chief Dale Young to give us more information on this. I appreciate you being here, Chief, first and foremost. And can you just tell us how you see this core program specifically benefiting residents here in Greater West Bloomfield?
Yes, good morning, Kevin. So, like what we just heard from Hillary is exactly how that would go for the residents of West Bloomfield especially. And what that is that as we encounter people that are going through mental health crisis, we'll now have another resource that we can utilize, I should say, to connect them to services. And just to kind of give some context to the need for this program, I can tell you that from January 1st through yesterday, that just mental health calls alone, and now these are just mental health calls alone, not where there could be crimes or other types of scenarios that are attached with it. Okay. There was 111 of those so far.
Oh, wow.
When it comes to attempted adult suicide, we had 4 of those. For juvenile-related attempt suicides, we had 1 so far this year. And then for drug overdoses, we've had 3. So we definitely have a need in the township for this program, and we look forward to partnering with OCHN to accomplish that.
Okay. Thank you for providing that data as well, so that, like you said, provides a little bit more context. So with that being said, prior to this program, what unique challenges has the West Bloomfield Police Department faced in responding to some of these mental health-related calls?
So, just so that the community is aware, we constantly train on mental health and how to respond to people in the community that are experiencing mental health crisis. Mm-hmm. But what I would tell you is that the police are limited in our responses to these types of incidents, meaning that the tools that we have oftentimes are not adequate to address, especially long-term, for the unique needs of the mental health community. So, for instance, sometimes, if warranted, we would need to take someone to the hospital on an involuntary basis. Whereas, as Hillary was speaking at the meeting yesterday, they may have other resources that they can connect this person to and possibly avoid that particular alternative.
Okay.
And then, again, it's the long-term help that they can provide.
Got you, got you. And that makes sense too, because that's not necessarily, the field of the police officer. Yeah, I can help immediately for whatever's going on maybe at the moment, but for that long-term care that is obviously going to be needed if it's a mental health concern, then now we have other professionals for that. So that would make sense as well. Now, I'm also curious as to how it's actually going to work. Like, how are mental health clinicians and law enforcement officers here in Greater West Bloomfield paired or deployed in these crisis situations?
So, as Hillary mentioned yesterday, there's a number of models that agencies use. That's something that we are going to work out with whatever clinician that we get paired with.
Okay.
And specifically, what we would explore is the benefits of having that clinician ride with an officer as opposed to possibly having them ride around by themselves and responding to calls as they see fit.
Okay. I would see, just in my brain, I would automatically think that they would ride with you, but I guess there's so many different ways about doing it. So I know those would be some of the things that'll be ironed out as well. With me right here live on The Splash, by the way, West Bloomfield Police Department Chief Dale Young, talking about this new program, the core program they are a part of when it comes to partnering with Oakland Community Health Network and addressing mental health issues and calls right here in our community. Now, if you don't mind, Chief, taking us a little bit behind the scenes, can you share how officers and these mental health professionals are being trained to collaborate under this program?
Well, this is definitely a brand new program. This is one that we have not trained with the clinician yet.
Okay.
So it's still very new. In fact, the onboarding process is probably going to take somewhere in the neighborhood of 8 weeks, so about 2 months. And so we don't have that information for you at this time.
Okay, makes sense as well. So hopefully as we continue to go a little bit further in the program, we can reconnect and get a little bit more insight in regards to that and other aspects as well. Now, how does the program ensure that individuals in these crises, like you said, they are going to receive that long-term help, but do you know of any other resources in regards to long-term help that they will receive?
So it's all going to be tailored to that unique circumstance. And
Okay.
so in the combination of the police and, of course, the clinician, they're going to create a plan, and they are going to try to connect that person to these long-term supports.
You know what I want to ask you, Chief, on your personal perspective, as Chief of West Bloomfield Police Department, how will you measure the success of this core program locally?
So one of the goals of this program is to reduce repeat calls, because there are some people that are unfortunately experiencing chronic mental health issues, and sometimes in the most extreme cases, we've gone out over 100 times over a couple of years, as an example. And hopefully through this program, what we'll see is that because they are connected with long-term supports, that would be drastically reduced, if not eliminated completely.
Good. And I would imagine that would be the case too. Just, let the police handle, other situations, and let the mental health professionals actually deal with the mental health calls and try to reduce those calls overall as well. That way, because like we said, they're dealing with the long-term solution rather than right on the spot solutions as well. I want to thank you so much for your time again, Chief. Any last messages or words to the community about this program, or you want to just talk about the importance of West Bloomfield Police Department collaborating with this program overall?
Actually, what I'd like to point out to our community, the Greater West Bloomfield community,
Please.
is that this particular program is actually going to be in partnership with the city of Orchard Lake, city of Sylvan Lake, city of Keego Harbor, and the village of Franklin. And so that this first year is actually covered by ARPA funds that are provided by the Oakland County Health Network. And after a year, where all the communities are going to have a chance to reevaluate the program and see how they want to proceed after that. And then the other thing I wanted to point out is that May is Mental Health Awareness Month. And I definitely would encourage anyone that is experiencing any type of mental health issue is to reach out to their support system.
Perfect, perfect. Thank you so much again for also explaining that as well. And we appreciate your time. Once again, from the West Bloomfield Police Department, Chief Dale Young, we appreciate your time and information, sir.
Thank you.